Rapid tests are in high demand this holiday season in Ontario. People lined up for hours today outside LCBO's liquor stores to get their hands on free tests. Many view them as a way to make gatherings over Christmas safer. But some scientists and doctors are warning that a negative result doesn't necessarily mean that gatherings are safe. Eric Artz is a professor with the Department of Microbiology and Immunology at Western University. He's also the Canada Research Chair in HIV pathogenesis. If I've got that right, my apologies if not, and viral control. Professor Artz is in London, Ontario. Thanks for joining us. Please correct me first on my pronunciation of that. Was I close at least?
Pathogenesis was just right on, Paul. So, yeah, no need for titles.
Fair enough. You are warning against the sense of security. Some people are pinning on negative rapid tests, that might be misguided. Can you explain that?
Well, I mean, since the beginning of the pandemic, even the regular testing, the PCR-based testing where, they stick a Q-tip up to your brain, it seems like, even those are not 100% effective in determining positives. And the negative tests, I mean, the rapid tests are in the same way even more difficult to apply, in the sense that you're either swabbing your nostrils, or you're trying to get as deep as possible, or you're swabbing the back of your throat. But the ability to do that effectively differs between people, surface areas, et cetera, that you're reaching. And all of those could mean you get more or less of the virus onto that swab. And you need viral material to actually get a positive rapid test. So that's one of the issues. And the other issue is just how and where this virus is replicating. So if this virus is replicating less in the nasal cavities, more deeper in the upper respiratory tract, you're not going to necessarily detect it. So that's all going to result in a negative test, but you may very well have COVID.
Gosh. It's like at every corner, it's something else you don't want to hear, I mean, is a negative test result better than no test at all if you're looking at going to a family gathering, let's say, over Christmas?
Yeah, listen, I don't want to overstate that, in the sense that a negative test, it doesn't mean you're negative. There's a fairly good result in the sense of a negative, and in all likelihood, you have accessed those areas that would have virus replicating in it. So these tests are designed for the purpose of screening people. And a positive, though, is definitively a positive in probably about 99% of the cases. And it doesn't matter if you're using the BD, the Roche, the Abbott, the EcoTest. All of these rapid tests have a very similar sensitivity because they're all sort of based on the same principle for testing. So when you have a negative test and you have symptoms that may be similar to COVID, the simple thing is just to repeat test yourself and do it the next day and the next day until you know that you're out of the woods for symptoms, and you probably will also be out of the woods in terms of having COVID. And in all likelihood, that sniffle, that cough may be just associated with the common cold, which of course is going around right now quite readily.
So in other words, on a rapid test, a positive is a positive. So you test positive, you act accordingly, you isolate, you do all those things. That's guaranteed. A negative might be negative, might be positive, so still be smart, do things safely, that kind of business. Is that the essence of it? Just to be clear?
Yeah, I mean, I'll give you a personal anecdote. I generally don't do this, but my son back in April had symptoms, and he went and got tested, and it was a PCR-based test, and it came back negative. We had a false sense of security, my family, thinking that he was negative.
On a PCR?
And the next thing we know, we were all positive, right? So, I mean, in some ways, those types of things can happen, and it's nobody's fault. It's just the way things are. and you just have to be very careful and diligent.
And that's you think of the PCR as the gold standard in these things at this point, So, well, from your perspective then, like what role do rapid tests play as we go down the path of fighting the surge of Omicron?
I think they play a huge role. And in fact, from my personal perspective, I wish that rapid tests were more available sooner in Canada. I mean, we've been waiting too long to roll these things out. I mean, they've been available in our stockpiles for quite a long time, and yet we were still relying on the standard PCR tests, which are very expensive to run, laborious, and take up a lot of our healthcare dollars. So I think they are excellent screening tools to at least provide some sense of comfort to us when you have to go into public situations. And, you don't want to put anyone at risk. And so at least if you still practice safe distancing and mask wearing, you can be in a circumstance where if you have a negative test, you feel a little more comfortable. I don't recommend taking off your masks in those circumstances, especially during this Omicron wave, because it's spreading like wildfire across Ontario and the rest of Canada.
So practical advice to people who are just coming to start thinking about rapid tests after all this time, who may be lining up outside liquor stores to get, whatever, who are looking to go and meet with small gatherings. What is your advice in the next few days?
Well, if your parents are coming to visit, your elderly parents, and you need to determine whether your household is safe, and you run a couple a rapid test on your family prior to them arriving, I think you can safely have a visit and feel comfortable about that. And if you know the whereabouts of these people and they have good information on the contacts they've been in, maybe with your close family, if it's in a limited condition and situation, you can not wear masks. But in areas where you don't know the contacts that you're making, a rapid test shouldn't give you that false sense of security. It shouldn't encourage you to be maybe a little reckless in not wearing a mask when you're in a public situation, because this virus spreads too easily. And, even as your last Dr. Offit said, is, you can be exposed and you can get infected. You can develop mild symptoms and you can transmit it.
In other words, it's one tool in the toolbox, not to pull that cliche out, but it's like so you still do the mask thing. You still be smart about small gatherings. You still steer clear. You still physically distance. All these things that we've been hearing about the last couple of years, and now we have this, rapid testing as well. Is that fair?
Yeah, and I'm very happy that it's out there and people are getting to use it.
All right. I suspect we'll talk again. This has been valuable. Appreciate your time.
Okay, thanks, Paul.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.